Hello and welcome to the Responsive Family Sleep Podcast. I'm your host, Kim Hawley, holistic sleep coach, lactation consultant, peaceful parenting educator, and mom. If you've ever felt overwhelmed by all the conflicting sleep info, frustrated with sleep information that just plain felt wrong, or searched desperately for a truly gentle and responsive sleep approach, then you are in the right place. In each episode, we'll be answering your most pressing baby and toddler sleep questions, busting those sleep myths, and helping you understand truly developmental, biologically normal baby and toddler sleep, plus encouraging you to trust your intuition along the way. Let's get started. Hello and welcome back to today's episode. I have my awesome colleague Austin here with me today, and we are going to be chatting all about bodywork and the ways bodywork can support you and your little one. And we'll start off with Austin. Why don't you introduce yourself a little bit, and then we can kind of jump right in.
Thanks, Kimberly, for inviting me on. I am a mother to 4 children, and my background is I am a licensed massage therapist, and I'm also an international board certified lactation consultant. And I use my background in lactation when working with families, providing craniosacral therapy. So I provide bodywork and help families with feeding, and primarily work with infants in bringing some ease into their bodies so they can feed and move and enjoy developing their little bodies.
You kind of have your IBCLC in the background just like I do, right? Because you do mostly bodywork versus clinical consults, just like I do mostly sleep versus lactation consults, right?
Correct. I use that education and information in my sessions, but I do not provide clinical lactation work right now.
Cool. I thought that was right because that's kind of how I use my IBCLC. It's mostly to support, with my most of my clients are nursing clients, not all, but most, and bringing that into my sleep work.
Mm-hmm.
So I'm excited to have this conversation today because I recommend bodywork a lot for a lot of different reasons. And I personally find bodywork to be the only reason that I am still running for myself. So it's like a big part of my own self-care. But I also find that a lot of families aren't particularly familiar with bodywork and why they may do it and what some of the benefits are. And so I thought we could just start off with simply on a simple level, what is bodywork?
So bodywork is any form of manual work on an infant or child or adult. It is just helping the body move efficiently. We are born brilliant. We're going to find a way to move and to feed and to breathe. And bodywork helps optimize this by releasing any restrictions in the body, in the tissues or muscles, so that they can breathe and feed and move more efficiently. And actually, I came about bodywork through lactation, sending families out for bodywork and seeing those big shifts and transitions in feeding and in movement and overall comfort. And that is why I shifted over to providing bodywork.
I love that. I love that. And there's a lot of different types. You do CST, and there are a lot of different modalities, right, for different ways that you can support an infant or a human of any age, I guess,
Yes.
through body work. Do you mind touching on a few of those and telling folks what is CST and just how does that fit into the bigger landscape of ways that people support through body work?
Sure, there are many modalities in body work, and I also make sure that I am aware of those in my community that I can refer out to for specific things. I always share with all of my families about infant massage, which is great for bonding and helps relieve muscle tension and has a relaxation effect. And this is something that parents can do with their infants. So that's something that they can be taught to do with them. There's also myofascial release, which uses manual pressure and stretching to kind of release any restricted movements in the fascia and the muscles. There's lymphatic drainage, which can help move and drain any stagnant fluid in the body that may be causing any constrictions or compression. There's also visceral manipulation, which focuses on releasing the restrictions that are in the viscera, which are the organs in the body. So a lot of gas and colic relief there. There are also chiropractors who provide support in releasing any restrictions that are in the joints, so that allows for more range of motion in the body and communication with the nervous system. Also, occupational therapy. They work with the baby's job of development and just being a new human, and help, treating any functional challenges they may have. And also physical therapy, focuses on the development and use of their body, and kind of helps with manual therapy, and also some exercises that optimize movement. So when things fire together, they wire together. So we have new shifts there. I provide craniosacral therapy, and I share with families that my fingers are trained to feel where there is tension in the body. And so I find where those traffic jams are and help reroute that traffic. And I use really light touch, which makes it great to work with infants. The most pressure I use is about 5 grams of pressure, which is the equivalent of balancing a nickel on your finger. And again, our bodies are brilliant, and I'm just working on restoring the health so that the body can self-correct and get more movement and ease and flow throughout the body, so that they can feed better, sleep better, and are more calm as they're going through this new development.
That's such light pressure. It's so fascinating to me, the different ways that that we can impact the body and the different modalities. I find it really fascinating, even though it's totally out of my element. Besides, I love bodywork personally. Though I've never gotten CST, so I feel like I need to change that.
Add that one next.
Yeah.
Yes.
Yes, I love it. So I know in my work, I am often suggesting body work in a broad sense, because I don't always have the ability to know who the best person is as far as modality goes, but also not everyone has access to the full scope of providers. So are there any high level tips that would help you go oh, this is a baby that really needs CST versus this is a baby that maybe needs to go see a physical therapist, or get some myofascial work, or any of those? How would one think through that as a parent?
That's a great access is key, and we don't have as many craniosacral therapists around the world. This is definitely something that we are deficient in, but I find that craniosacral therapy is a great first picture if they can come to somebody to kind of look over the whole body. We assess the whole body and find out where those restrictions are, learning about sleep, the birth, how the family structure is, and just kind of bringing ease. Anybody who is born can benefit from craniosacral therapy for being such a light, non-invasive form of therapy to bring ease within the body. And when I'm looking to refer out are babies who have significant challenges that we are not seeing big results in the first few weeks. A lot of that is torticollis. A lot of that can be things that are showing up in plagiocephaly, brachiocephaly, and the flat head, just shaping changes in the body. Babies unable to look in another direction, that have a significant head turning preference, or who may have some state regulation challenges that are just not calming, that they're just very hypersensitive. That's a great reason why to send off to OT, physical therapy. I do address everything. We work on sleep. I ask families, where does the baby sleep during the day and in what positions? And where does baby sleep at night and in what positions? And that I can also give some functional changes that they can do at home to optimize that, and movement. If babies are in the same position, how that can just kind of increase that tension in their body. If they're swaddled for long times and are looking in one particular position, and how we can change that up a little bit. And feeding is more than just things that are happening in the mouth and the tongue and the jaw. It is a full body exercise. The infants use their entire body when it comes to feeding. It's a whole body practice. So, looking for if there's some tightness in that jaw and tongue, or baby can't nurse on the right side or has trouble bottle feeding when the parent has them in a different position, that is something that I work on to help check, how is it, if there's a restriction or any tightness in the jaw or mouth or tongue, it's going to affect the throat and the chest and the abdomen and the hips and the knees, the calf, the feet, and the toes. So I'm going to act like a detective and find out where that tension is, that tightness that's causing that difficulty in feeding as well.
And that can happen with oral restrictions, right? Like tongue ties, that it's not just right around, it's not just the tongue that's restricted or the jaw, that the fascia tension can cascade kind of down the body, and we see it in other ways and show up, right?
Yeah, we do. And it also is something too that I check the cranial nerves to see if there's any impingement there that's not allowing for that optimal oral function, and how to bring about more ease so that they can feed more comfortably.
Yeah, I feel like no matter how babies are born, it's like kind of a lot on their bodies. I mean, like it's how, it is how, I mean, assuming you have like an uncomplicated vaginal birth, that's how babies have been born, but also like that's still a lot on their body. And then if you throw in any sort of like assisted delivery or a C-section, and it's like a whole different set of, things going on to be born, that it, across the board, that can be, there's a lot of opportunity where I could see something getting tight or pinched or, something that can cause problems.
Yeah, causing that challenge. And it's, I also ask about pregnancy, how the baby was carried, what position baby was in, because if they're low and down for a long period of time, babies grow in the space that they have. So if it's a tight space, you're going to grow in that space. And especially if the head is turned one way, or that hand is up, or that hip is shifted a little bit, they're going to come out with that same pattern. And I share with parents, if you've ever woken up and you slept weird and you can't turn your head to the left, and you're going through your day, and so you're driving, you have to look to the left to see if traffic's coming. And so when you do go to look, you're moving your whole body, that you're twisting that whole upper trunk and shoulder and neck and head to see if any traffic's coming. So that whole body is moving in that position. And a lot of times when we roll a baby over to their belly, or if they're on the body feeding and they look, like they're pressing up really hard and strong, it's that connective tissue is all tight and it's working all together and not individually. And so that is what I'm helping ease. I'm helping ease so that that neck can just turn by itself and not the whole body going with it.
Yeah, I love that. I feel like, in my work, I'm often flagging body work for feeding issues, right? Because, feeding and sleep are so interconnected. I flag it for digestive issues to see if we can get some better, just if there's any tension that's causing digestive issues, or that communication gut to brain. And like, I feel like sleep via just regulation. And of course, if they're colicky, if they're uncomfortable, if feeding is an issue, like, that it can be a piece, right? Like sometimes we also need, of course, a lactation visit and a clinical
Mhm.
like assessment on feeding, or we need to
Yeah.
go see if there are ties, and are these ties that can be body work and do it? Do we need a release? Like, so many
Mhm.
pieces, but I'm often when I'm working with a baby, especially the younger babies that are just really finding sleep really, really, really hard. It's like, why is this much harder than like, your classic normal amount of waking? And I always love when my clients can get a body worker, whatever kind of body worker they can get access to and
Yes.
into without a crazy long wait, to
Mhm.
get those hands on to see, like, do we have tension? Are we mouth breathing because we have low tone or because we have high tone and we have tension? Is this baby uncomfortable? Or do we have a lot of asymmetry? And that sort of expertise, because it's such a clear route to work on sleep, that we can support their nervous system, we can support any discomfort. And sometimes just like, okay, everything looks really good. And that's clearly not what's happening here. But I feel like that's such important information when we're kind of scratching our head, going like, what's going on with this baby, and why is sleep so hard? I mean, toddlers too, but I feel like a
Yes.
lot of times there's so much with babies, is where I see it come out more so.
Yeah, just being able to be comfortable to let go and fall asleep. Is there any digestive, challenges and pain, gas pain? I work a lot with babies with gas pain, kind of getting that ease through those organs and get some
Mhm.
movement. Reflux is something too, having that acid, if that's uncomfortable, let's work on what's pulling up at that stomach, what's pulling at that sphincter that's allowing for that to
Yeah.
open up and have that acid come back up and not just stay down with the milk down into the stomach. Being able to bring about that parasympathetic nervous system, the one I
Yes.
know you've talked about a lot with your families, that rest and digest. And that is something that's brought about through body work and craniosacral therapy, is down regulating. And that just kind of brings in also the parents. I also provide parent and child sessions, parent and infant sessions, to work on both. So when we're working, you we have a saying in a lot of the lactation world, heal the mother, heal the baby. And
Mhm.
so, when we're working with the families, we're working as a unit, as a dyad, and it's not just the infant we're working on. But during a session, just kind of, talking about things that we can help, or even doing some hands-on work with the family too, or hands-on work while the baby is feeding on the parent's body, and bringing that ease and calmness into the space, where then later a lot of families share, when they go home, babies sleep longer during a sleep session, because we find this work integrates best during sleep. That is when that rejuvenation occurs.
Yeah, I love that because it speaks to the whole like parent and baby nervous system are interconnected. And so
Mm-hmm.
if your baby's not sleeping well or having feeding challenges or having digestive issues, that's stressful as a parent. And
Mm-hmm.
while we want to help what's going on in baby's body, we also need to give some support to the parent's nervous system. And so I talk a lot with my clients about regulation and like your own regulation around bedtime, around sleep times. If you've had a baby that's been fighting sleep and sleeping, waking hourly, let's say a night, that anticipatory stress and anxiety about how is it going to go? How long are they going to sleep? How long's bedtime going to be? Like that can inadvertently contribute to making it harder. And so if we can step in and notice where the parent is struggling and give some nervous system support, that can make such a big difference, just spilling over into, oh, the parent is calmer, the baby picks up on the parent is calmer, the baby's able to be calmer, you
Absolutely.
know,
Absolutely.
versus, oh my God, my parent is unsettled. So there's something to be unsettled about. And it's not in a blaming
Mm-hmm.
way, right? Like just even like any little bit
Mm-mm. No, it
calmer,
just is.
right? Just in an
Correct.
awareness kind of way. I see that a lot with sleep. And then I've heard that from so many of my clients about going to Bodywork and it making like a noticeable difference, especially babies sleeping on their own or sleeping in a crib or like sleeping at night just flat, even if you're bed sharing. I can imagine for so many babies, if they have tension in their body that's not comfortable laying flat, and especially if they're on their own and kind of having to manage without the co-regulation of contact, how much harder that could be if they're also uncomfortable for whatever reason, to manage that.
Right. Yes. And I address the tension of the body that could be caused by overly tight midline tissue. And so
Mhm.
that relaxation of that midline tissue can help babies get a little bit more ease so that they can sleep better, deeper, and easier.
I love that. I love it. So, and I think we've kind of woven throughout, right? Like through the big ways that people often seek out body work, and also so many of the benefits of releasing that tension and helping babies feed better and be more comfortable and sleep better. Like if you were thinking about a parent of a baby going like, should I get body work? How do I go about getting body work? Do you feel like there's anything else helpful or important for that parent that's just like on the cusp of thinking like, is this a helpful modality for them? What should they be thinking about, or what should their first steps be?
I highly recommend, whoever you may be working with, pediatricians send clients to me, lactation consultants, doulas, really tap into any parenting resources, parenting groups, support groups, asking them who they've used, asking other parents who are going through the same journey and challenges you are. They can be your best resource, and ask if anybody has had body work done recently, or in your community, and find out who those people that they recommend can be really beneficial. There are some directories of people who've been trained in these modalities that can be really helpful, that I can share with you to share notes as well. To find, Google can be great. Finding that there are people finding me through Google, but about a good 98% of families that come in to my office are someone else recommended that they come in. So, really finding that community and asking for recommendations, and also knowing, who, or asking questions when you are looking for body work. Are there things that they will empower or give to parents as well to do at home, so that they can continue doing some work on tummy time, or exercises, or oral function exercises that the parent can continue to do at home and not need to take their baby somewhere all the time for an appointment, because appointment fatigue is also something that parents can be going through, but something
Yes.
that they have consistent support with, that they can also do at home, can be very beneficial to have somebody who provides body work to also show the parent things that they can do at home for their baby.
I love that because, man, some of my clients that have a lot going on with their littles, they are like in and out of body work and PT and like,
Mm-hmm.
you know, different visits for different this and that. And it's like, it's exhausting just hearing them talk about it. And I'm not the parent dragging like, this 4, 5, 6, 7-month-old baby, um, from appointment to appointment. And so that ability to have exercises and simple things to do at home, I think is so important. And you're right, when I am referring outside of the DC area, right? Because DC area, I already have my people, including you that I referred to. But I also have like the whole big, new parent birth worker communities that I'm a part of, as you are, that I can ask for recommendations. But when I'm seeing families, nationally or internationally, I'm like, did you have a doula? Did you have a lactation consultant? Because that's like lactation is usually the first place that I would assume would have a
Mhm.
local bodywork referral list. And that is
Mhm.
hopefully looking at, were these people effective? Did they help improve our outcomes, and getting feedback from their clients? So that's often what I do, since I can't always know the local scene and everywhere. But it's hard. Some people, it's like they find people and the wait's long, and it's challenging. And I didn't prepare you for this question, so feel free to tell me you don't know. But like, are there any good online, like, if a parent doesn't have the access and feels like their baby would benefit from body work? I know there's online massage stuff,
Mhm.
but like, are
Mhm.
there online beyond just beyond, not just baby massage is awesome. Beyond baby massage, are there any online, like, teach a parent how to do some basic body work to support their baby resources that you're aware of?
That would be an incredible resource, something that is in the back of my mind to create. I have not found it yet, but things that I do give parents, or if I talk to a parent who is on my wait list, things they can do now, of course, are infant massage. And I do have someone local that I refer out to often, and also can it does virtual teaching. And I also will teach, skin to skin. Skin to
Yeah.
skin is something that you have right there that's going to do a lot of what I'm doing as well, with hands-on work with the nervous system. But, bringing baby and caregiver, nothing on from belly button up on both. That includes no bra if someone's wearing one. Bringing baby up on the chest high enough that they can bend down and sniff the top of the baby's head or kiss the top of the head.
Mhm.
Baby's chest up against caregiver's chest. When those sternums come together, it turns on these C afferent nerves, which are going to decrease pain, induce sleepiness, aid baby into getting in the right sleep cycle. It's going to help with brain maturation.
Mhm.
It's going to help with state behavior. It's going to help with intelligence. And I usually have all these really well stated in my brain all the time. But so many positive things. It also decreases cortisol, that stress hormone, in both
Yeah.
the caregiver and the infant. And it increases the oxytocin in both caregiver and infant, and also aids in digestion and milk production if it's the feeding parent who is holding the baby, all by just holding them onto their body. And I encourage them to do it through one sleep cycle. So if they have a wrap or a skin to skin device that they can wear, that can just kind of help, or just get in a comfortable position where you're leaning back and baby's up on their chest, covered with a blanket. Parent could have a robe or a button down shirt over, and that's something that can kind of restore and rejuvenate both parent and infant now, and get that ease in the body. And having that ventral surface, that belly, that time open, their chest open, because breastfeeding position or chest feeding position, where the baby's face is up and the chin is in the breast tissue and the arms are out to the side, is also tummy time position. So when we optimize one, we can optimize the other.
I love that. It's so, like, kind of get back to basics. Like, we have that
Mhm.
power. Yes, obviously skilled assessment and fingers and hands and awareness from professional are amazing, but I love that kind of coming back to that just ancient parent baby connection of
Yes,
two
yeah.
hearts, two nervous systems coming to
Mhm.
communicate. My 5-year-old will still sometimes lift up her shirt and lift up my shirt and be like, "I wanna do tummy to tummy, mommy."
Yeah, mine used to do that. My youngest used to come up and do tummy, 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 tummy.
Yeah.
So yes, it extends and has positive benefits throughout that connection. Absolutely.
I love that. I love that. Oh my goodness. I love talking with you about body work. And it's, as I know, before we got in this conversation, so many of our thoughts, it will align. in how we think about that dynamic, that parent, that baby coming together. As we kind of wrap up, any sort of final thoughts or things you think parents should be thinking about when it comes to CSD or body work more broadly?
Just, reach out to your community, finding other families, no matter if you are finding, resources through that, you're also finding other people and that connection. And also knowing that you're not alone because there are other people going through the same thing. Or if you're searching, in a group, at 2 a.m. while you're feeding a baby and there's other people up, you're not alone. But jumping into that community, finding those resources, one of my favorite things to do is network. So I'm happy to help find people all over the globe who do this work for families. It's not as many as we need in the world, but helping find that and asking questions. Some providers do home visits. I used to do that before the pandemic. I did home visits, which was great to be in the family's environment. But now I can't see as many people in a day if I'm traveling. But other, providers do that. So asking those questions and, and receiving it yourself, see if there's any other providers who do parent infant or parent baby, parent toddler appointments as well, to kind of get the whole family, involved and in that same feeling and energy level and healing together. But following that, step into that intuition. And if you feel that your baby needs something else, reach out and find someone else to put their eyes on them and be able to see, where there may just be a challenge or tissue tightness. And that once that's relieved, the baby can have, more ease in feeding and movement and sleep and digestion. And everyone deserves to have that comfort as they're developing.
Yeah, I love that. There's so much wisdom to share parent to parent, right? Like just hearing about who other people have seen and their experiences. There's just so much wisdom there. Well, I'm going to grab this from you later, but tell folks where they can find you, and I'll put it in the show notes for those people that are local to us in the DC area or just who might want to connect with you virtually.
Yes, I serve the Baltimore area in Maryland. My business is called Nourish and Align. My website is nourishandalign.com. On there is my contact information. Feel free to email me. I'm happy to help find people in any community if I can, share with directories or answer any questions. And I have a pretty extensive frequently asked questions on my website. So just to use it as a resource for learning and understanding craniosacral therapy, you're welcome to check it out.
Awesome. Thank you so much for chatting with me today. I really appreciate it.
Thank you, Kimberly, for this opportunity. It's been a joy.
Thank you for joining me today. I hope this episode left you feeling more informed, confident, and encouraged on your sleep journey. And just a reminder before you go that nothing in this episode is individualized to your specific sleep situation, nor is it to be taken as medical advice. Take what resonates, ignore what doesn't, and check with your healthcare provider about any medical concerns. Take a moment to subscribe to this podcast so that you'll never miss an episode. And take a moment to rate, review, or share an episode you love on social media. All of that helps parents just like you find me, this podcast, and this gentle and responsive sleep information. I'll see you next time.